Greetings from Washington, D.C. This is Peter Thomas, the General Counsel of NAAOP. There are three main developments we wanted to bring to your attention. The first is the demise of the American Health Care Act in the House of Representatives. This is the bill that would have repealed and replaced the Affordable Care Act. NAAOP's major goal is to maintain access to orthotic and prosthetic care. And our biggest concern was the repeal and significant changing of the essential health benefits package, which includes coverage of rehabilitative and habilitative services and devices. NAAOP, the Alliance, and many other rehabilitation-related organizations worked hard to preserve that language in the original bill and to have it regulated in such a way that it would preserve access to that benefit, and we don't want to see that go away. The American Health Care Act would have repealed the essential health benefits package for Medicaid expansion populations, but it would have preserved it for the private insurance market. Late in the discussions on the House side, the Republicans did have, with much pressure from the conservative Republicans, did agree or tentatively agree to repeal the essential health benefits package in the private market as well. And of course that would have, and probably clearly would have, impacted coverage down the road for prosthetic and orthotic care. So we were very concerned. What's going to happen next on the Affordable Health Care Act? It's unclear. The bottom line is that there is still a very strong interest in moving forward to repeal and replace the Affordable Care Act. But the conservatives and the Republican and moderate Republicans have not been able to come to an agreement. Of course, the Democrats oppose major changes to the Affordable Care Act. They are willing to move forward with tweaks and changes to the law to improve it, but they don't want it repealed. So we're at a bit of an impasse, and the real question is what happens now. There's a couple of different options that Speaker Ryan and Leader McConnell and President Trump have. The first is that they could try to bridge the differences between moderates and conservative Republicans and move a bill over to the Senate for further debate. But that doesn't seem likely, given the high pressure that was exerted in the recent past that was not successful in forging a deal. The second would be to just pass a straight repeal bill and worry about replacing the law in the future. That doesn't seem like it's going to happen either, largely because the Republican moderates are not comfortable with that strategy. And finally would be to work in a bipartisan way to try to improve the Affordable Health Care Act without necessarily repealing it. Not clear whether that can occur, although there have been statements on both sides of the aisle about the interest in doing that. Again, our biggest concern is access to orthotic and prosthetic care in the future, and NAAOP will be working hard to make sure that that's maintained and hopefully enhanced. Next, I wanted to make sure that you were well aware of the BIPA Section 427 regulations, the proposed rule that came out, comments for which were due on March 13th. NAAOP and the O&P Alliance and each one of the O&P Alliance organizations submitted separate comments to that rule, as well as many other organizations that represent various aspects of the rehabilitation healthcare continuum and the consumer and disability populations. They received about 5,000 comments to that proposed rule, which is a very significant amount. We'll be working with CMS to make sure that CMS does move forward with this and publish a final rule and issue the rule in final form at their earliest possible opportunity. But make no mistake, we're up against a headwind, and that headwind is regulatory relief, and that headwind includes an administration that does not want to impose new regulations on healthcare providers or anyone else. So we have our work cut out for us in that regard. And then finally, if you recall back in December, the Agency for Healthcare Research and Quality, known as AHRQ, issued a request for comments on a protocol that they intend to use to study and develop the evidence base and identify evidence gaps for lower limb prostheses. A new protocol was just published that has adopted a number of the comments that NAAOP and the O&P Alliance submitted back in December. So we're feeling good about that. They'll look at a lot of additional studies in this review that they would not have otherwise looked at had they not accepted our comments. However, we don't know exactly where this is going, and we don't know exactly how this interacts with the Interagency Committee on Lower Limb Prostheses, which is examining some of these same issues. So we will be submitting comments again to this revised protocol, and we will be keeping you in touch to make sure that you're well aware as things progress. Thanks so much.